Hello and welcome to the Society with Fatma Shaheen at PTB World. In the aftermath of floods, we have seen infectious diseases on a rise, we've seen waterborne diseases on a rise, we've seen vector-borne diseases on a rise, and of course by that virtue, respiratory issues and skin issues on a rise too. Now considering of course that the numbers are expected to rise in the upcoming weeks, more so months as well, it is extremely important that we talk about this health aspect, this health catastrophe so to speak, especially when it comes to talking about the floods. And this is exactly what we'll be talking about in our today's show. Not only that, we'll also be talking about the various challenges which are being faced for all the people out there, more particularly by the healthcare professionals when they are treating all these flood-stricken victims, going out there in the medical camps. We'll try to get a real-life narrative on this, and we'll also be talking about, of course, the way forward. When we talk about this issue at a very basic level, we understand and appreciate the fact that floods, as they have occurred in Pakistan this very year in 2022, they are being associated with climate change, and in this regard the whole debate of climate change, that becomes very relevant too. So when we talk about, of course, adapting to or mitigating to such natural disasters, it is very important that we, of course, in that context also talk about climate change, and this is something that we'll be touching upon during the course of today's conversation. We'll be talking about ensuring that Pakistan seeks a climate justice, and when we talk about ensuring that, of course, Pakistan seeks climate justice, what role can the international community play in this regard? This and much more to follow on today's show, and to do that, let me introduce you to my today's panel. My first panelist for the show today is Dr. Bilal Azim Bhatt Saab, who's a physician and he's also a social worker. Assalamu alaikum sir, and welcome to the show.
Thank you.
You're most welcome. Alongside him, I have Dr. Madiha Rao, who's a board-certified clinical dermatologist. Assalamu alaikum, madam, and welcome to the show.
Thank you for having me here.
You're most welcome. And via Zoom, we'll be joined by Dr. Rana Jawad Asghar Saab, who's the CEO of GHSI, and he's also an expert on infectious disease and an expert on global health too. Assalamu alaikum sir, and welcome to the show.
Walaikum assalam, and thank you for inviting.
You're most welcome. Well, to get the conversation started with you, Dr. Bilal, I think to start from the basics, it's very important that we talk about your real life narrative of visiting, one of the worst flood hit areas, more specifically Sevan Sharif in Sindh, which you had the opportunity not only to visit but also to, have a medical camp there. In that regard, of course, treat the patients who actually did come to you. So in this regard, what were the most glaring observations that you made as, a doctor, as a healthcare professional, in terms of treating such patients that, disease aside, how aware, how sensitized do you feel were these people of, the ailments that they were suffering from? And of course, by that virtue, how open were they to treatment too?
I went to Sevan Sharif with Fatma Jinnah Medical University team. We were about 12 doctors who went to Sevan Sharif in Sindh. It is the area which has been mostly hit by flood.
And rather worst hit by
flood, exactly. And what I saw was that there was a lot of poverty, there was a lot of hunger, there was pain, there was illness. Actually, the magnitude of the disease was very high. The magnitude of the affected people was very high.
Right.
I think there are several people, I cannot even tell you the number of the affectees, but there were people who had no shelter, no tents. The medical diseases that I most commonly, or my team most saw, was number one was the infectious diseases. And in infections, there were bacterial infections, there were viral infections, there were vector-borne infections.
Right.
Then other than the infections, there was problem of food, problem of shelter, problem of clean drinking water.
But which were the most common? Because I think the most common, which we do see at least on television media otherwise being reported, are the gastro issues. And then we've also seen, of course, it is the dengue season, as we all understand, and then dengue has also been a very surging high, and then different kinds of infectious diseases too. But if you were to categorize which were the most common diseases out there, and who do you believe are the most vulnerable?
In our camp which we did, we found that the highest prevalence was of diarrheal diseases that included viral diarrhea as well as bacterial diarrheas, followed by respiratory tract infections, then several viruses, and there were also vector-borne diseases, although less at that time, and followed by skin diseases. So they were the most prevalent in that duration of the time. And what we did was that we took several medications with us for the treatment of those diseases. Actually, the magnitude is so high that you cannot imagine that one team can do.
I was about to say that. I think this is something that will come, but of course later during the show. Madam, coming towards you, he's mentioned about skin diseases. Now, from what I understand as an objective bystander, when we see, all the media reports, when we see TV channels, for some reason or the other, I at least feel, and correct me if I'm wrong, that, skin diseases perhaps are not being reported as openly or as much as perhaps are other diseases, be it waterborne, be it vector-borne, or for that matter, infectious diseases, so to speak. So when it comes to skin diseases and, people, of course, suffering these various kinds of diseases because of course, being exposed to contaminated flood waters, what kind of microorganisms you feel cause such diseases, and why is it so important that we also report and give due importance to these diseases as well, because a lot of times we see that they are very conveniently ignored.
Yes, most of the times we think that skin diseases are not lethal, but they are in cases if any diabetic person is suffering from any skin disease, which is bacterial infection or fungal infection, should be taken care of. Other conditions which we see most commonly in flood affected areas are staphylococcal infections, streptococcus infections. They are bacterial infections which can cause fever, which can give you fever, cellulitis and things like that. So they should be treated initially because the people are living in a very unhygienic condition over there. So we should be taking care of the hygiene as well, plus taking care of the infections that are present there. Living in those humid and hot climate which is present, we see ringworm infections, and plus we are seeing scabies as well.
Right. And I was actually going through this report which is very clear in its findings that in Thailand, when floods came, one of the most common diseases were those of actually the skin, and I think also talks about even eye infections like conjunctivitis. I think that is something a very pressing concern as well, but more often than not we haven't seen, at least to the extent of media, these diseases being talked about as much as of course other diseases are being talked about, on which I'll come to you, Dr. Rana. I think we must also talk about, of course, the very surging high numbers that we do see of infectious diseases in this regard. So as somebody who is an expert on infectious diseases, do you feel that the numbers will rise, and we do see in routine, generally at least, that these diseases, they do hit us in routine every year in Pakistan?
As you said yourself, that after the monsoon season or in the monsoon season, we see the increase of those cases of infectious diseases. Like any family physician can tell you that the August, September months are when they see most patients in the whole year. And so this is a period where we are already vulnerable for infectious diseases, and then add on to this historic floods in Pakistan and vast areas of Pakistan underwater, millions of people outside their homes and living in difficult living conditions, as Dr. Bilal was saying, that without tents, without a shelter. And you put all this, and these are the real good breeding ground for many infectious diseases. And that's why I actually will go a step further and will say that it's not that we will see the increased number of cases. We are already seeing increased number of cases. And as you could say, like in Karachi and Lahore, we already have reported.
So even in Rawalpindi, we've seen that dengue has been on such a surging high. But sir, taking on from where you left, now as somebody who of course has also been surveillance system expert, I think a very important question which then arises is that you not feel that it's time that we actually kind of analyze the trends of all these disease outbreaks. We have experts like you in place, so that we can actually monitor and we can have the accurate data in place so as to catch these early outbreaks timely, and of course by that virtue treat people timely too.
That's very rightly said, but the problem is that no one considers surveillance important enough to invest in it. And for people like me are advocating for this for last 15 years, that Pakistan should invest in the disease reporting system. And people think disease reporting as the weekly or monthly report of how many died or how many were sick of certain diseases. But to be a real good disease surveillance system, it should be at par of any intelligence system. So when we are fighting a war with an enemy, human enemy, we invest heavily on to get intelligence gathering of our enemy. That's called military intelligence or a similar type of intelligences collection. But when we are fighting with an enemy which is more potent, more stealth, more adaptive than a human being, which are viruses and bacteria, we do not want to invest any resources into it. And that's have been our challenge. So the problem in Pakistan is that, even people claim, in reality, we do not have a good disease reporting system, a surveillance system. So all these numbers many of these are estimates, are highly underreported numbers.
So this
So
is
what
exactly why I posed this question, because until and unless we have accurate data, until and unless we do have accurate numbers in place, how can we accurately then, in an informed manner treat people? So I think this is something that we exactly need to draw out of this catastrophe and perhaps look at it, as maybe, that silver lining on the cloud, another way to look at it. But Dr. Bilal, coming to you, I think we must also talk about the challenges here, because we have seen a lot of doctors like yourself going to these flood-stricken areas and, with, of course, the noble aim of treating patients. But we've also seen that this has come with its own set of challenges. I've seen doctors complaining that, they haven't been given perhaps proper, a personal protection equipment. Then there have been doctors who've said that, they've gone, but when they've come back, they've fallen ill themselves. So as somebody who has been there, what do you feel are the most pressing challenges for any doctor, for any healthcare professional, for that matter, even social workers, to actually go and help these people out?
You're exactly right that there are a lot of challenges when you go there and when you work there. I'll give you an example of myself. When I came back from Sindh, I fell ill and I was ill for about a week, and then I got better. I probably caught some infection from there, and I must stress on the thing which Dr. Jawad has said, that the time has come that we need to put an emphasis on disease surveillance, disease prevention, and then disease control.
Yeah.
The time is now here that we would declare that these specialists who are public health specialists, surveillance specialists, they should be the mainstream people in policy making regarding the disasters and regarding the epidemics.
Right.
Now the problem which arose when I was there initial was that the magnitude was very high. We took medications for a limited amount of patients, but there was a big magnitude of the patients who were there. Then other than the medications, there were other issues that were related to the flood affectees, like food, like water, and like other.
In terms of, I think, medications, you'd be in a better position to comment on this further. Like, are specific medicines being given to people specifically for the specific ailments, or are you just giving them, generally painkillers, be it Panadols, be it Calpols, or for that matter, the general first aid kits that we usually do have, for which I believe there is an international standard?
We were giving them proper medications. Initially, there are two phases in which you treat a patient. Number one is to treat the symptoms, and the second part is to treat the cause. In treating the symptoms, we give analgesics like paracetamol or other drugs. And the second thing, initially, it is difficult in an epidemic to diagnose a patient, but with history and few other things, you can I think give a differential diagnosis to a patient, and for that cases you can give anti-malarials if you are suspecting malaria, and antibiotics if you are suspecting infection.
Right, sir, your point is noted, on which I'll come to you, Dr. Madi. I think he's raised some very valid points on which I would want you to deliberate further, but of course from the viewpoint of a dermatologist. Like, when we talk about skin diseases, we've seen that some diseases are those which are very easily identifiable. They can very easily be of course diagnosed and treated per se, but then there are those for which of course you have to wait, you have to observe the symptoms and then make a proper diagnosis and treat people. So at the end of the day, given of course that there is an influx of diseases that all these people are actually hit by, do you not feel then that skin diseases, there's a very strong chance, probable chance that treatment of skin diseases that could possibly be ignored?
Yes, we have been ignoring skin diseases till now, and we should be taking care of those as well. I think we should be providing the people some survival kits which has some kind of band-aids to treat the cut wounds, traumatic lesions, and there should be some antibiotic creams, antifungal creams in that kit, so that each and every person which is exposed to certain organisms, they should be taking care of themselves as well. Plus, we should be giving them good hygienic measures, like providing them some Dettol or some bleach, which they can put in water and take a shower. If not possible, they should be cleaning themselves up with a clean cloth dipped in Dettol or some bleach water, so that there are less chances of getting infection.
So, are these particular concerns which she has raised, be it in the case of respiratory disease, be it in the case of infectious diseases, or for that matter, a vector-borne or waterborne diseases, are they all particularly actually, addressed?
Actually, it is difficult because if you want to follow an ideal pattern and provide them with all the kits and all the things, the magnitude is so high that you cannot provide all the people with all the things.
So inevitably, one way or the other, one kind of disease will be ignored, basically.
Slightly ignored, but we can try that we educate them, we tell them how to have a good hygiene, we can tell them some hygienic things that they can start in their life, and that can reduce the amount of infections.
I think you've raised again a very valid point that the key should be to educate them, on which Dr. Saab, I'll come to you. I think Dr. Saab here in the studio has raised some very valid points that the key, the focus of the whole exercise should be to actually make people aware with regards to keeping themselves safe, of course in the limited resources that they do have. So in this regard, sir, being an expert on global health and of course on infectious diseases as well, what are the tips that you would give to people out there?
So as Dr. Bilal said, there are so many people out who are vulnerable, around 33 million people. And in reality, we cannot treat 33 million people. So our strategy should be to prevent those people from getting sick. And to do this, we have to do a two-pronged strategy. The number one is to control the waterborne diseases, and we could do it very easily by providing chlorine tablets, providing small filter flasks or thermoses, or some small pumps with filtration system in it, and these are readily available. And through that they can treat the water which is right around them, the dirty water, and make it drinkable. By doing this, we can prevent a lot of infectious diseases which are all waterborne, that include all diarrhea related diseases. Then the other area is which is the biggest threat at this time is the vector-borne diseases, and for that we need to make sure and provide them mosquito repellents, bed nets, or just mosquito coils, so they can reduce the spread of the mosquitoes close to their tents or wherever they are living as minimum as possible. And government should also help them to provide spray, especially in those areas where there are big relief camps and a lot of people are staying in a closed place.
Right.
So by doing those two strategies, we can reduce the threat of infectious diseases to 70%.
Right,
and that's a huge reduction, which is easily doable only to prioritize our intervention to these two areas.
So basically, sir, to summarize what you said, then, of course, provision of clean water by that yardstick, of course, proper sanitation, and of course, a lot of focus should be placed on actually ensuring proper hygiene. And in this regard, I think it's very also important and imperative to mention here the fact that, there needs to be proper coordination as well in terms of actually, giving them relief, in actual provision of, kits as well, because, you should only give them the things that they need. And, a lot of times we also see that, people are going out there, but perhaps they are not going out with things that they actually need. And I think you've raised a very valid point in this regard that, things like, mosquito repellents, or for that matter, mosquito nets, these are the things which they would be needing more so, considering that, of course, winter is around the corner and we do see, dengue on a surging high in the cities too. But sir, coming to you, I think sir has, actually very nicely summarized this whole thing that, what are the things that we need to do and what is the thing that we need to steer clear of. But when we talk about actually doing this in practice, how easy or difficult it is to do that? Because, when we talk about so many things, when we talk about it from a theoretical viewpoint, I think it's easier said than done. I also feel that, the medical camps, of course, set up by doctors like yourself who are taking out their time to go and actually treat such patients, part of them should also be very geared towards making patients aware, giving them little tips like perhaps, using smoke to actually keep, mosquitoes away. And this is something that we have seen, people in the rural areas of Pakistan doing. So do you not feel that, the focus on education, that is something that should also, come at the forefront here?
Yeah, you are absolutely right. We should focus on their education in preventing diseases, because in that way the patients will themselves be educated and use some methods like smoke, as you have said. They would know that we need to clean the water, and they will ask them to adopt some hygienic measures by which the diseases can be reduced. I would like to add one more thing that Dr. Jawad has already said. I think the doctors who have, I have also gone there. One thing which we need to do on a personal level and on a government level is that we need to train people to work during disasters or during pandemics or epidemics.
Right, so your point is noted, on which I'll come to you, Dr. Madi. I think we must also talk about the fact that, we have seen that there have been some concerns being raised, more so from, healthcare professionals, even from some social workers, that, who are going there to actually help such people out, especially those who are actually falling victim to various diseases in the flood-stricken areas. They complain that, they come back unwell, they come back sick. So how do you propose can we then actually strike a balance between ensuring that, people, they do go out there to help them, but at the same time they don't do it at the cost of their own health?
So we have learned a lot from the COVID pandemic. We have learned how to use sanitizers, how to wear proper masks, how to wash our hands daily with using antiseptic soaps, water, each and every time we touch a patient, washing our hands, using gloves, using masks, and providing those people with sanitizers as well, so that we can stay clean and stay uninfected.
Right, madam, your point is noted, on which I'll come to you, Dr. Bilal. I think we must also talk about the fact that, considering of course that there are possible health risks for those who are visiting such areas, are there any, vaccinations given to doctors or healthcare professionals like yourself who actually do visit such, medical camps in order to treat patients?
When I went there, we were not actually vaccinated, but I would recommend that when people go there, they get vaccinations, especially for enteric fever or typhoid. We took prophylaxis for malaria and prophylaxis for travelers diarrhea, which was metronidazole, but I recommend that they should be given.
And not only basically healthcare professionals like yourself, but I feel anybody and everybody who's actually visiting that area. Right, so your point is noted, on which I'll come to you, Dr. Saab. I think a very important question which then does arise in this regard is the fact that, we have seen, lots of cases of, insect bites and of course snake bites coming forward too, with people being reported that, they are being subjected to the same. And then we've also seen that, of course, we understand the fact that, when cattle die, when animals die, and, such exposure with humans of their dead bodies, that in itself can also pose very serious potential, health risks for people at the end too. So when we talk about, disposing of dead bodies of animals, do you feel that this is an issue which is being given due importance? And if not, then what is the way forward?
No, it's not being given any importance that how to properly dispose of the dead animals. And in flood situation, there are hundreds and thousands of cattle and other animals who have died, and we need to dispose of them properly. The challenge is that lack of understanding of how important is sanitation for our own health. That's why you see heaps of trash at many places and people just adding on to it and not making sure that they put their trash in a proper place. So I think that there may be lack of education or lack of emphasis of cleanliness and sanitation, which is actually part of our faith also. But in practice, we are not following it, and that creates problem. But in these times, especially in the flood, after flood areas, flood affected areas, the chances of spreading major epidemic due to lack of sanitation is a major threat, which we are very concerned about it. And the people should at least do on their self-help basis properly dispose of dead animals, bury them, don't let them lay open, because eventually they will infect them, and they can be, the dead animal can make them sick also.
On which I'll come to you, Dr. Bilal. I think the question then remains is, of course, to actually educate people, all the flood stricken victims out there, about the very basic need to, of course, have basic hygiene hygiene practices, with of course giving them due support where needed. But moving on from this, I think since the show is about, of course, the society at large, it's very imperative that we also look at this from a gender lens. Now, when we talk about, women-related health issues, I think a very important aspect which we must also talk about during the course of today's conversation is that of, of course, women who are expected to deliver in the upcoming weeks and, of course, months. So, as somebody who has had that benefit of visiting, in fact, being part of these very important medical camps, more so in Sindh, do you feel that, we have adequate, provision out there to treat such women? Because, of course, there are a lot of social cultural concerns which would come into play when it comes to treating such women.
You've raised a very important point. When I went there and saw the patients, I saw that a women who came to me for or all to our camp for checkup, they had 3 to 4 children and they were pregnant. According to some data, it is expected that about 1 million women are expected to deliver by December. I think the way forward here could be that we can establish mobile vans or mobile hospitals with the provision of delivery, and we can have lady health workers or trained birth attendants, if not doctors.
I think we also need to have more female doctors out there
Exactly.
to treat them, basically, because that is again another concern. A lot of times we see, and this is something which has actually been voiced, that people have actually left their women, when they've migrated from one place to the other, just because they didn't want the women in their families to mingle with, men they did not know of in other relief camps. So, madam, as of course the only female panelist and a doctor in your own right, would you want to add something to what Dr. Saab said?
Definitely. If we cannot get access to doctors, there should be trained nurses, LHVs and midwives which can help, and other working staff which can help those females, and mobile units should be there which help in the delivery of the females, and plus the pregnant female should be well fed, well taken care of. They should be given nutrients and vitamins as well, so to produce good healthy children.
Right. So these are, and of course, I think in this regard, of course, the very concept of community health, I think that becomes very relevant too, of course, with that whole concept of midwives and everything. I think local community engagement, that should be our focus at the end of the day. Dr. Saab, coming towards you, I think a very important question which again arises in this regard is, since we are very particularly focused on, talking about the health catastrophe which has actually emancipated from these floods, is the fact that, a lot of times we see, and this is something that we actually saw in the COVID-19 pandemic as well, that, people's routine chronic diseases, be it, cardiac diseases, be it diseases related to lungs, or for that matter, other diseases, they were being ignored in the course of treating them for COVID-19. So do you feel this is a genuine concern? This is something which actually can come up, because, we don't know, what kind of people are out there, what kind of diseases they actually suffer from, and if this is a concern, then how should we aim to address it? Because again, at the end of the day, this will put a lot of, burden on the healthcare system, so to speak.
Very true, and that's what we are seeing already. Because the immunization drives are not going properly in those affected areas, and they are disturbed. From the Sindh, we have started seeing reports of diphtheria cases also. So diphtheria is also a vaccine preventable disease, and if the vaccination is proper or complete, then the kids should not have diphtheria in these days, but that's happening. So everything get affected because of the natural disaster. That's understandable, but how quickly we can overcome the disruption and start providing the expected care as much earlier as possible will help our population. And the second thing is that, we have talked about a lot of other diseases, but the other thing which we sometimes miss is the mental health. And what I have seen, because I have gone to 2010 floods, which were historic floods in Sindh also, and I saw even young kids who were stranded alone on in water for 72 hours, and then they had a mental shock which had to be restrained to taken care of them. So the trauma is so big. Not only just by being out of your house. There are many females, the girls who have never gone out of
So even being out of schools, for that matter, so many children, they have actually lost their right to education at the end of the day. So, actually making them, live in camps under certain circumstances, and of course not allowing them to have that routine that they used to have. I think this indeed does cause a lot of psychological trauma. But sir, moving on, since of course time and again we do do see that, these floods have been associated at a very basic level with climate change. And of course, when we look at the broader picture, this is an issue that we do need to, consider and of course address by that yardstick too. So when we talk about, of course, climate change, when we talk about Pakistan seeking climate justice more so from the international community, what should our expectations be in this regard?
So, that's true that we are not at fault or we are not the culprit, but we are facing the consequences of the climate change. But on individual basis, I think we should again focus on planting trees, because the tree cover is being reduced. In my lifetime, I have seen how the green areas have now been turned into the big buildings or the housing societies and all those kind of things. Even though that impact will come up many decades later, but we need to stop it. From the international community, I don't think we can expect huge things, but we need to build our infrastructures resilient for to withstand the future floods or future natural disasters, because that's keep happening. NASA has just released a 100-year record of showing the hottest month in every year, and as we go across the century and come to these days, these are the highest, the hottest days or the hottest months on the record, and the effect of climate change has not stopped, and that put us in danger.
Right, sir, your point is noted, on which I'll come to you, Dr. Bilal. And to conclude today's show, I think a very important point then arises is the fact that, of course, now that we are looking at, of course, rehabilitation not only of people, but of course of their, lost homes, their houses, their properties too. So at the end of the day, how far do you feel have we come, and what more is it that you feel needs to be done?
We have reached the rehabilitation phase. I would like to tell you that in rehabilitation there are several issues that need to be addressed. The first issue is their shelter. We need to build homes for them or tent houses for the affected people. The second, we need to treat their non-communicable diseases, because with time we'll move from communicable diseases to non-communicable, like uncontrolled diabetes, uncontrolled hypertension, cardiac diseases. So that need to be addressed, and we need to establish health units that can provide treatment to those non-communicable diseases. Later on, like as Dr. Jawad has mentioned, psychological or psychiatric management of the people, because when they are affected, they can suffer from post-traumatic stress disorder, PTSD, depression. I'll tell you a story that I met a girl who was about 10 to 15 years old. She was unable to speak, and her father told me that her brother drowned in the flood, and after that she's unable to speak.
So what are the tips that you would want to give to people out there, especially those who do volunteer to go out to all these areas to help those people, and tips not only for doctors like yourself, but also for young social workers or people from the civil society wanting to go there and actually help people in the need of hour?
I would like to tell all the volunteers that plan to go to those areas that firstly go prepared. Think of the place where you are going. That place would require you. Then before going, get training of some sort, like training in medications. Do study about the diseases that are common there, how to manage, give first aid to people. And then if you are taking some ingredients with you, like some food, make sure that you take material that is not affected by temperature, like don't take liquid.
Right, so your point is noted, on which I'll come to you, Dr. Saiba. And to conclude today's show, I think it's very important that when we talk about, of course, looking at this whole catastrophe, we must also, of course, equally consider the issue of climate change, something which we have been doing, time and again. But at the end of the day, if we were to make, our children aware of this very issue, more so, children, those who are studying in educational institutions, be it in schools, be it in colleges, be it in universities, do you not feel that, it is time that we make our curriculum more inclusive of, environmental issues, more so, climate change as a subject and of course as a topic?
Yes, first of all, the teachers should be made aware how to teach it, how to promote it, and then it should be added in the books from the very early ages, from the very early years, so that children should come to know about it. As we have been seeing that we added chapters of domestic violence and other problems as well.
Life skill based education,
yes,
as well, madam.
So it should be there. So we must be knowing what to do, how to treat it, how to avoid it.
Right. And I think this is also very important because at the end of the day, I think this is something which has also cropped up in the conversation earlier, that when we talk about combating climate change, when we talk about combating, those issues related to the environment, a lot has to do with our personal lifestyles as well. So until and unless you educate people, until and unless you sensitize, children at a very early age about the same, how can you expect them to be, future leaders bringing about change? On which I'll come to you, Dr. Saab, and to conclude today's show. So what would your concluding remarks be in this regard? That of course, when it comes to, going back to the situation as it did exist, before these floods, they hit us, when it comes to actually, seeking complete rehabilitation, when it comes to doing away with the destruction that has been caused by the floods per se, be it in terms of, livelihoods that it has destroyed, be it in terms of infrastructure, or for that matter, properties and homes of people, how long and cumbersome do you feel will this journey be, and why is it so important more than ever before that, during this journey we all stand together as a nation?
I think the experts have estimated that it may take years to fully rehabilitate the whole area which is affected by the floods. But once we move to that point, we need to start respecting nature. We need to not encroach on their natural waterways. We should not build inside the rivers just to have some more money or some more things. So we need to respect nature and live with the nature peacefully. Otherwise, nature has much more power, and every few years it teaches us this lesson that we need to stay within our limits, and we should do that.
Right. But at the end, I think the change is something which should again, emancipate. It is something which should emanate from us as a society more onwards, going by that virtue at a national level, then of course at an international level. Right, sir, your point is noted. On which note I would like to conclude today's show. Thank you so much, Dr. Bilal. Thank you so much, Dr. Madiha. And thank you so much, Dr. Rana, for being here with us today. Well, to conclude today's show, we generally spoke about the health catastrophe that these floods have posed for us. We also spoke about the various challenges that people are, more so, healthcare professionals are facing in the course of actually treating people out there in these flood-stricken areas. A lot needs to be done, but a lot is also being done. And when we talk about, of course, devastation that has been caused by the floods, it's very important that we also talk about the very pressing cause of which, climate change, which is of course being attributed to it. In this regard, it is very important that Pakistan is given its climate justice, and in this regard, of course, nobody can ignore the fact that the global community, the international community, that does have a very pivotal role to play. On that note, signing off for today. Until next time, take care and Allah Hafiz.